All right, so what we have here is a chicken breast with the skin on, and we're going to go through a couple of different suturing techniques. What we have here to start with is a 2-0 vicryl rapide. You can see here this is on a CT1 needle. When we open this up, we'll take a look kind of at the anatomy of a needle. That'll be covered in the PowerPoint slides. You can see here that we've got a 90 centimeter length, a CT1 type of needle. It's a tapered point. It's a half circle needle. The vicryl rapide, it's undyed, so it probably won't have that characteristic purple color that most vicryl or polygalactin has. So there we go. All right, let's take a look at the needle to start with. So the two parts of the needle that we don't really ever want to be grabbing with the needle driver are at the tip, because it will considerably dull the tip, especially if you have a cutting tip. And then we also don't really want to grab at the swedged end here where the suture is attached to the needle, because if you crush that area, it can loosen the suture and it can turn your suture into a pop-off accidentally. We've got here kind of the full curve of the needle, and what we typically do is to grasp anywhere from about halfway back to a little bit closer to the swedged end, depending on how much needle length we need to drive through the tissue. Obviously, the further back you are on the needle, closer to the swedged end, the more you really have to crank your hand over to be able to get a good kind of angle of attack on the tissue. So if you're working with an area where you don't need, if you've got thinner tissue, so you don't need quite as much penetration with the needle, then you can kind of choke up on it here, and you don't have to crank so far over to be able to get that needle to go perpendicular into the tissue. One of the other things that we talk about a lot of the time is angling the needle at kind of a 45 degrees like that. That allows you to get access to the tissue while keeping the needle driver kind of up away from the tissue, so to speak, and we'll see some examples of that. So what we're going to do is just a simple interrupted suture here. We've got our cut chicken breast here with the skin on, so we're just going to stabilize tissue here, and again, we want to kind of poke through. We don't want to skim into the tissue here. If we're going a little bit deeper, we want to poke down at a right angle, come out. You can see here in the middle of the tissue here, grab with our forceps, and oftentimes if the tissue is soft enough, we can just kind of curve that needle out with the forceps and then just reload it here at the skin. What we'd like to do is avoid really having to grab the needle with our fingers and then increase our risk of poking ourselves. So first bite through there, we've got the needle reloaded about 3/4 of the way back from the tip towards the swedged end, and I've got just a little bit of an angle there, kind of open it up a little bit. So again, grab that tissue, kind of open it up, go in, curvature of the wrist to pop out, grab the needle, pull it through to forceps, reload at the tissue. Now, if I'm going to be tying this, I want to protect the needle if I'm going to be setting it down, or even just really holding on to it. So we'll pull our suture through. I'm going to set the needle driver down, and then we're just going to do a very simple two-handed knot. So again, I go over thumb first, create our loop there, swing through with the finger, bring that shortened through, and then again, I don't really cross hands, but I do kind of go opposite directions, or you can just kind of pull straight up and down like that. You can see how that draws the tissue together, but it does relax a little bit, so we want to keep a little bit of tension up as we come up over the finger for that second part, and then as we come down, that tightens up nicely. So this is vicryl. We want to do 4 throws, 2 complete square knots. So back over thumb, and then over finger, and there we go. So that's our interrupted. We want to cut that usually about 1 centimeter, give or take. One of the things that we oftentimes talk about is burying the knot. So if we don't want to have the knot kind of sticking out above the skin, we can bury it. The way we do that is, instead of starting on the outside of the tissue and then popping out down here on the inside, so kind of going out to in and then in to out for our second bite, what we would do is we would start on this opposite side and start here and go in to out, so to speak. And then pull that through, and then we're going to come over to this other side and go out to in. So now our two loose strands, so to speak, are down in the interior of the tissue. We want to make sure that we're not locking that, which I was a little bit. There we go. So as we pull this through, we want to shorten it up so we have a relatively short side to tie there. So I'm getting caught up on my T-pin. All right, so now as we tie this, what I like to do is get both of these on my side of the loop, so to speak. So we are going to bring this back through. All right, so now you can see that we've got our loop is on the outside, so to speak, and our free end and the part that the needle is on here are exiting down deeper in the tissue. So once we get that set up, then we're just going to do, again, over the thumb first, and then tighten that down, over finger, over thumb, over finger, so 4 throws to complete score knots. And then you can see that our knot is down here in the tissue itself. So on the outside, we just have suture. Up here at this first one, we've got a visible knot, but here the knot's buried down the tissue. So just going from, and we'll just do another one of those quickly. So starting, instead of here on this right-hand side on the outside, starting the other side, we go inside to out, and then outside to in, pull that through, and again, I like to get this free end on this same side just so we don't end up kind of locking that. And then over thumb, over finger, thumb, finger, 4 throws for vicryl to complete score knots. Again, so we've got that buried knot. I think I might have locked that a bit. All right, so that's just simple interrupted. And again, we want to get the needle attacking the tissue perpendicularly. We don't want it to really slide into it unless we're taking a very, very superficial bite, but we really want the needle to be at a right angle to the tissue, and then as soon as you poke in, start to rotate your wrist. That way you don't go too deep. Come out, at least visualize the needle in the middle of the tissue. You can go across in one pass in some instances. If you get to this point and you just have a little bit of the needle tip that's visible, you can just re-grasp over here, drive a little bit more of it through, stabilize with your forceps, and then you can rotate it out with the driver or with just the forceps itself. Grab, we're going to protect this. And again, thumb first for me. Always a good idea to practice knot tying with a pair of surgical gloves, because that's how you're going to be doing it in the operating room, and so you want to get that feel for handling instruments, handling suture, tying suture with surgical gloves on. So there you go. Simple interrupted with exposed knot and buried knot.